said about, the work that the city has definitely undertaken in the last 2 to 3 months. Everything has had to kind of, be sort of business as usual without it being usual circumstances. So
Right.
I think everyone has done a fantastic job, and I'm so sad Kim can't be here because I always sing her praises and she's never around to hear them. So
I know.
yeah.
Yes.
But anyways, thank you for that. I
course.
didn't have very much on the agenda just because things have been so unusual, and we've kind of all been focusing on COVID. Carol, I don't know if you have any updates regarding COVID. I know our case numbers are continuing to look fantastic. So if you want to comment on that, I can do a little bit of an update. And then at the very end, there's obviously just a lot of other things happening in the world right now that I wanted to just quickly address. I don't know if it's something that the board can do much about, but I think it's worth it to just mention it. So with that said, and with that loose agenda in mind, take it away, Carol.
Well, hello. I just wanted to give a shout out to the school nurses. They're rounding up their school year by helping me. So they've been helping me since March on the coronavirus problem and have reached out to the community, making calls, cold calls of people that were tested positive, finding out if they're okay, finding out if they need supplies of food, and done an awesome job with it. They end on June 10th. And then hopefully Kim has come together and has figured out a way to provide more funding for them to work through the summer. So that's the good news. So if we do have a spike, which I'm hoping we don't, we will have the school nurses available. Yeah, we are still reaching out to community. There have been a few people in our community that have been hit so hard with COVID, they came home very, very sick. And one particular was a single mother with 2 college-age children that she was the sole provider in the family and has really come home struggling and very sick and very upset, finances, worried about everything. And the city really rallied around her and has provided her with what she needs and is helping her get through it. Mm-hmm. So I'm so excited to say that the city has been awesome with the community. Anybody that needed anything has received it.
Yeah,
as far as I know, 311 was
That's good to hear.
Well, yeah, it was a great.
Yeah,
it was great seeing.
I don't have the statistics, but I know in addition to all the work that you and the school nurses have done, the outreach crew has been definitely hard at work providing food banks across the city to many families in tremendous need. So I believe that is ongoing, and I think just this past May, we had the Mask Up May program where a lot of cloth masks were made by fellow residents of the city and donated to folks who needed them. So we had a lot of kind of grab and go mask programs that were happening alongside the grab and go kind of food banks that were already in existence since the pandemic hit. So lots of great work, lots of, as the mayor always says, a lot of opportunities for a lot of people to really rise to the occasion and kind of show up for their city. So yeah, really proud about that. Anything else that you wanted to mention, Carol?
No, I think I've done it. You can talk about COVID though. What's going on.
Well, I mean, I think just a bit of an update because we obviously haven't met for a while now. But I just want to kind of give some updates. We all know COVID is still here, although thankfully the numbers have been looking a lot better. If Carol keeps track of all the numbers, and I kind of log into the revere.org/coronavirus website every day as well to see how it's looking. And thankfully the numbers are continuing to look good. We're still getting cases in the teens and sometimes even single digits. We had one day last Thursday where we had 21 new cases, and who knows if that had anything to do with Memorial Day weekend and kind of everyone being a little antsy and going out. It might have been, but if it truly was due to Memorial Day, I'm glad that it was only 21 and not far greater. The city continues to reopen, as a result of these improving numbers and continually stable and low case numbers. The city continues to reopen. Phase 1 is underway, for hair salons and barbershops and for other businesses. Office-based buildings can start to bring in folks to do work in person in their offices. And City Hall, there is a news publication that just came out. City Hall. Oh, thanks, Joe. City Hall also reopened yesterday, so lots of cleaning protocols. Uh,
Mm.
we call them the mandatory workplace, the mandatory standards of safety for the workplace. So every business kind of has their own version of that, to ensure that our workforce continues to stay safe and we continue to keep COVID at bay. Phase two is coming in a couple of days, I believe June 8th. So next week, if the numbers continue the way they're at, and so far it looks like the numbers, as a whole in the state, are mirroring Revere in that they're also similarly stable, which is great. So hopefully phase two can continue. And I believe the restaurants are actually in phase two. I apologize, Carol. I haven't been able to come to some of the emergency response team meetings because of my other job at MGH. So I don't know if there's been any talk about more businesses reopening then. I don't have a lot of details, but I do know that so far, so good. I mean, there have been kinks along the way, but so far, so good. And I think the residents have been doing a fantastic job really complying and just doing the right thing. There hasn't been any enforcement, definitely not from in terms of our board of health, and I don't think police and fire have really had too much. There was that incident with Easy Pie where they had a drive-in movie night, but they had a ton of cars that came, so the parking lot wasn't big enough, and there were kind of cars everywhere. There were people who were working at Easy Pie who weren't wearing masks, kind of directing, but the police and fire came in, organized the situation, and we learned a lot from that. And I'm hoping we can continue to have really fun activities for our residents throughout the summer, kind of thinking outside the box and having creative ways to have fun and do that. Because I think things like drive-in movies and things like that should definitely continue. It's a safe way to, get out there, get out of your homes, get some sunshine, and just enjoy the summer with your family. So we definitely learned a lot from that. But those are just some examples I can think of off the top of my head for kind of ways the city is reopening, both within the confines of the reopening plan set by the mayor, but also folks thinking outside the box and just, the rest of the city come together, working with them to try to achieve these goals. Because I think I think this is the new reality, and I'm hoping we'll have a lot more, fun things like that come down the pipeline. We just have to make sure it's all done safely.
That's true. If I could just add to, just for clarification, so there's no misunderstanding. Yes, City Hall is open right now to employees only.
Yep.
We are not open to the public at this very moment, but that we foresee is in the near future. We're still in the process, I know, at least with municipal inspections, building and health, coming up with protocols of what that will look like in the event the public needs to have access to those buildings, because we want to make sure it's done in the safest way possible, not only for the constituents, but for the employees as well. So I would strongly advise anyone, to go on Citizen Serve and access, whether it's through building permits, everything can be done electronically. We do have some of the staff right now that's going in the office on a limited basis. That is to be able, they're retrieving voice messages and emails daily. They haven't missed a beat. If people need to have access to public records and like the file jackets for building and health, we're asking that they submit a public records request to the city clerk, and we'll do the best that we can, because we don't have the full staff is not in the office. So we're trying to plan in advance now to be able to meet the needs that we expect will come up in the near future, but to be patient and to have a plan. We are having conversations about what that would look like if somebody needed to have a meeting with a building inspector or an electrician, and how that could be done maybe through Zoom or electronically, to really try to keep people out of the building at all costs. Because especially in building and health department, it's not like City Hall where it's so big, it's very narrow. We share space with Veterans Affairs, and we just want to make sure that we can have the 6 feet apart for the employees and for people coming on off the street. And we don't want to refuse business to anybody, we want to make sure we can answer and accommodate everybody's needs, but as safely and effectively as possible. So right now, as far as I know, and from talking with people from building and health, business is run as usual. We're not behind. Inspections is still occurring, and that goes for the building department and on the health side. Things are just really flowing nicely. We're just trying to put in all the precautions we can now. So in the event phase 2 does, everything opens up, and I don't know. I haven't spoken to the mayor to know an exact date what that looks like, because he's going to make sure it's opened safely. We have that put in place now, but things are in the works. So if anybody has any questions pertaining to the health department or any needs, they should be encouraged to go on the city's website, and everybody's contact information is there. Phone numbers and emails can all be accessed through the city's website at revere.org, and they can go into departments and look for each department. And that goes for contact information for any city employee, quite frankly. And they should get a response in a very short turnaround time.
Thank you for clarifying that too, Cheryl. I definitely forgot to, I assumed that everyone was talking about employees, but never assume. But yeah, thank you. Definitely open to employees only. But as you had mentioned very eloquently, that we are hoping to get business back up in a slow and kind of measured fashion. And first and foremost, have to make sure all of our employees are, as you said, safe, adhering to the 6 feet rule. And then hopefully we'll begin to introduce residents into City Hall for business. But for right now, only employees only are allowed in City Hall, and a lot of things that can be done in Access should be done and can be done online or calling. All right. Is there any questions or anything else from anybody? Or no? The last thing we might be able to end this meeting a little bit early. Just the last thing I wanted to mention is the mayor and the chief of police and fire did also do like a bit of a press release on what's going on in the world right now. There's, in addition to coronavirus, what's compounding that is a lot of suffering on the side of our Black community across the country. We had a lot of we are still having a lot of protests happening in Boston and surrounding communities. I think Somerville, Jamaica Plain. There's a lot of cities with protests. I'm not sure if there's one being planned in the city of Revere yet. Neza, you're muted, Neza. Yeah, sorry. It looks like you're.
Yeah, sorry. I think it was one that was actually, I heard that was scheduled for Friday, but it's been canceled.
They canceled. Okay. I mean, again, there's a lot of energy out there, and rightly so. There's a lot of frustration and suffering and anger out there from lots of different parts of the country and world, quite frankly. So, I'm sure at some point there might be some sort of protest or rally organized in Revere. But I think Kim Hanton had a wonderful email that she sent out to the emergency response team. There's just a lot of emotions flowing, and I hope that we can take the time. I know everyone's been really busy. No one has really had time off, least of all the nurses or the school nurses. But hopefully, we can have some time to ourselves the next coming days or weekend or weeks to really think and reflect on what's been going on, and hopefully we can ally ourselves with our with the other people of color or persons of color, and kind of help and be an ally and be actively anti-racist against this. I think we can all agree that we are only as strong as our weakest link, and if we keep squashing down one entire population of Americans, then we all suffer. So hopefully we'll be able to kind of take some time to reflect on that and see how we can go forward. Health comes in many shades and many faces, and it happens in many sectors. Health is not just about how well your heart is ticking and how well your blood pressure looks and what your vital signs look like, but it's really a composite of your environment, the food you eat, the air you breathe, where you live. And I want to ensure that your life expectancy shouldn't depend on the color of your skin or the zip code that you were born into. So I think as kind of a local board of health in Revere, I just wanted to take a minute just to kind of share those kind of sentiments and just address that there is a lot of suffering out there. We have a long way to go, and the platitudes I'm giving right now are going to do nothing to solve it. But I just want to kind of put that out there and just make sure that at least you guys heard kind of my opinion on it, and I'm hoping this is kind of me opening the door to a greater conversation that we can have in the coming months as we heal, not from the coronavirus, but from the structural racism that's been going on before, during, and it's going to continue to go on after the coronavirus unless we are active about it. And a lot of that is going to be uncomfortable and checking our own privileges at the door and really starting by looking into ourselves, and that's going to be uncomfortable. But I hope that we can, align ourselves with Mayor Rigo's administration, with our chief of fire and chief of police, and come together and work together for this common goal and this common good.
I agree. Well said, Dr. Kong. My hat goes out to the families that have lost loved ones to these types of situations. It's just heart wrenching. I don't think any one of us, no matter what color or race, can't, have a really heavy heart when you watch TV and see what's going on. I think I could probably speak for everybody that I work with, all my colleagues, is that, the voice and the message is to get the message out. You want the message not to be overshadowed by the violence, because then the message gets lost. And I think the rallies, we would just hope that they are structured and planned in a way that people hear what you want to say and not see what you're doing and shadow, all the good that they want to get people to hear. It doesn't take away from the message. Just be peaceful about it, be smart, be safe. And that's how you'll be the most effective. And I know from municipal inspections at a minimum, we all have very heavy hearts watching the news and watching what this family has gone through. It's just horrific. And know that we can rally together, and it doesn't matter of the race or the color or the background. We're all lives matter. It really is important that all lives matter, and we stick together and as a community and as a society to do the right thing for, the person standing next to you, regardless of what they look like or what their skin color is. And
yeah. I mean, I think if there's anything the coronavirus has taught me is that we are truly all stronger together, and that together should really mean together, that we all, no matter the color of our skin or who we worship or who we love, should be allowed a seat at the table. And we really need to, start to be more active. I'm reading a lot about racism, and it's not enough to just not be racist, but we have to be actively anti-racist. And we really need to start thinking about that and what that's going to look like for our city. What do we want it to look like? What are the best practices? Carol knows this. The city of Revere has set a lot of fantastic examples of contact tracing, of mobilizing, and of really coming together to do the most amount of good for the most amount of people in the city. And after seeing that, I truly believe if we're all putting our heads to it, if we're all putting our heads on this problem, if we're all putting our hearts into it, we can definitely all mobilize similarly to ensure that we as a city can be actively anti-racist, and to make sure this doesn't happen again, and make sure we kind of look at the structure of our own, hiring practices, or other, just many, many things we can look at in terms of structural racism in our city alone. And I think we can definitely make a huge difference. We may be not as big of a city and flashy of a city as other places in Massachusetts or around the country, but if the last few months has shown me anything, is that we can still make a big impact, even if we're not, Boston or New York or LA or something. So hopefully we can continue this discussion going forward. And I'm hoping, I'll have to talk to Kim about this, and maybe you, Cheryl, too. I wonder if getting police and fire at the table with us too would be a great start. I don't want to take away from the efforts of reopening. I think that is certainly going to be a priority, but I don't think it's too much to ask to say that we can do this in addition to the reopening, not to take away from it, but to do it alongside it, because I think it's just as important.
I agree, 100% agree.
Yeah, I agree.
We need to hear what people want and need, and do our best to accommodate that. As city employees working for the constituents out there, we need to definitely hear them.
Oh yeah, definitely 100%
Yeah.
need to have the table. And I think we just need to learn more about it. I mean, I think a lot of what we can do can just start within our own homes and our own households. And just learn, I'm a big proponent of getting all the facts straight and, knowing as much as I can about something before kind of diving into it. And this is going to be no different. I have a lot of learning to do myself. So yeah, here we go. 2020.
We all do.
Yeah. I don't have anything else on the agenda. There's nothing really formal. I don't know if anyone else had anything to add or say. Okay. So I guess we can call the meeting then.
Yes, absolutely.
Yeah.
It's
We'll say
7:04. Sounds good.
And we'll say the next meeting.
Everybody, I appreciate everyone's time. Thank you to the public.
Thank you. Thank you, Cheryl.
Yeah.
Thank you very much.
Nice to see you.
Good night. Stay safe, everybody.
July 7th, Tuesday, that's going to be our next meeting. So just put that in the calendars. We'll let you know if anything comes up and we can't, have that meeting have that for whatever reason, but I do want to try and get back to some normalcy. So I'd like to try and get these meetings back up so that we serve the community. So Tuesday, July 7th, 6:30 to 7:30, we'll be sending some emails out. All right.
Thank you.
Thank you, Dr. Kong.
Bye-bye.
Bye, Carol. Bye, Cheryl.
Bye.